Hi, multidisciplinary team part 2. So, other people or colleagues or co-workers or professionals that you are going to encounter while working in advanced countries are number one, the respiratory therapists. So, just as the name implies, respiratory therapists, they take care of the airway of the patient. So anything that pertains oxygenation, ventilation, taking care of artificial airways and all that, they do that. So you work very closely with these people, and it will serve you, to cooperate with them so that your patient can get the best. They run shifts just like nurses do. So when you are running shift, there will be an RT there, respiratory therapist. There will be an RT there. Then another set of people we work very closely with is the CNAs, the certified nurse assistants. So just as the name implied, they assist nurses. That's what they do. So those roles of a nurse that can be delegated, that is what they do, such as getting vital signs, feeding the patient, uh, positioning the patient, cleaning the patient, taking the patient for a walk, all those things that does not require critical thinking as a nurse. The role of a nurse that does not require critical thinking, they get to do that. So, and you can delegate some things for them to do, but just make sure it's within their scope of practice. Part of what you learn in nursing school, or part of what you learn when preparing for the NCLEX exam, is the kind of tasks you can delegate to the CNA and the kind of tasks that they can do. So the CNAs are very, very important. In fact, if you have a good CNA on your shift will be so much better than not having one, or having one that is not helpful. So CNAs are very critical in the success of your shift. Another set of people are the occupational therapists, that's OT, just as the name implies. Then physical therapists, PT, and then there's the speech language pathologists. So these people, mostly you'll find them if you work day shifts, or you see their notes in the patient's medical record of what they did, how they moved the patient, and all those work that they do. You will see all that there. Then I think that's pretty much it. No, there's a telemetry tech, the teletech. These are technicians that watch the telemetry, because the nurse is not always in one place. You're always moving from one place to another. So there is a dedicated person who sits in front of the monitors and watch the ECG. The ECG monitor, they watch it. If anything sticks out or is an issue, they call the attention of the nurse. Now, let me quickly talk about the categories of nurses you may work with. There is the registered nurse, of course, and then there's a licensed practical nurse, or in some states they call them the licensed vocational nurse. So LPN, licensed practical nurse, LVN, licensed vocational nurse. So these nurses are registered nurses. The difference between them and the RNs, now the registered nurses, is scope of practice. And that scope of practice borders on initial assessment of patients and IV therapy. So in some states, though, there are states that allow LPNs to do a certification, IV certification, so that they can give IV medications. But generally, the boundary between LPNs and RNs, like I said, is just the initial assessments and IV therapy. So I think I've covered pretty much everything. Thanks for listening. Make sure to like, share, subscribe, and follow for more.